Welcome to this special edition of On the Pen, the Weekly Dose podcast. I'm your host, Dave Knapp, man on the Manjaro. That's why I'm here. You are on the pen, Wegovy, Saxenda, Ozempic. That's what we're talking about today, because today was the Q4 earnings call for Novo Nordisk, and we've got a lot of information to get to. Now, if you're just joining us for the first time, welcome. I hope that you'll hit the subscribe button. I hope you'll hit the thumbs up button, and I hope you'll stick around to learn all about GLP-1s. But I want to give you just a quick flyover of what we do here at On the Pen. Excuse me. I want to give you a quick flyover of what we do here at On the Pen, and that is we take the news that is intended for the investor community. We take the news that is intended for the medical community, whether it's earnings calls or clinical trial data, and we basically take that information and we translate it into patient-centric information. Because we want to always do what we can and do our part here at On the Pen to bring patients information that will impact their conversations with their medical providing team so that they can have more competent and confident conversations and ultimately lead to better treatment and better outcomes in their lives. So if you have enjoyed the work that we've done at On the Pen in that regard, let me know in the comments of this video. And if you're new here, I hope you'll join along for exactly what I just outlined here. We've been doing this for 2 years now. We've been covering very closely the Eli Lilly earnings calls for over 2 years, and the Novo Nordisk earnings calls we've been following like a little bit more at an arm's length, just because Eli Lilly seems to, it's funny how this kind of all shakes out. Novo Nordisk was sort of the first to the party with Ozempic. It wasn't the first GLP-1, but it was definitely the first GLP-1 to enter the zeitgeist of popular culture. And the fact is, though they were first to the market with Ozempic, the first weekly GLP-1 for that was ultimately approved for weight loss under the brand named Wegovy, Eli Lilly came out with Mounjaro. Zepbound is the weight loss version. And so we've covered Novo Nordisk a little bit closely, more so because I'm on Mounjaro. But there's so much to get into and so much that we've covered here in the past, and we'll continue to cover this stuff closely. So the story today, as you're hitting that like, hitting that bell, and hitting that sub, is that Novo Nordisk is maintaining their dominance in GLP-1. The single stat alone that jumped out to me listening to today's earnings call was that 2/3 of the GLP-1 market belongs to Novo Nordisk. Just think about that. With as big as Zepbound and Mounjaro are, and they're not even the only GLP-1s, of course. Eli Lilly also has a GLP-1 called Trulicity, though it's only indicated for type 2 diabetes. 2/3 of the market is still owned by Novo Nordisk. And though their stock has taken quite a hit over the last couple of weeks and in the last month or so, they have come roaring back today on some amazing information. So let's get into it. I'm going to show you the presentation here as we kind of move through what we learned today. But translating this into real dollars, because when you listen to these earnings calls for Novo Nordisk, you get everything in terms of Danish kroner instead of the US dollar. So we're kind of going off of a loose exchange rate, which is obviously fluid. So take these numbers, into consideration. But what we learned today is that sales for Novo Nordisk in 2024 grew 26% to $40.56 billion with a profit of $17.91 billion. Absolutely staggering numbers. Not necessarily surprising when you consider that number of 2/3 of the GLP-1 market belonging to Novo Nordisk. Wegovy prescriptions in the US, Now, Wegovy, again, is the weight loss indication of semaglutide. And the Wegovy prescriptions in the US doubled from January of 2024 to January of 2025. Wegovy expanded to an additional 15 international markets, and in all of this somehow managed to remove or report to the FDA that all of their doses of Wegovy and Ozempic are in available commercially. So go figure, right? Novo Nordisk also dominates the global obesity market, and you can see in the graph there just wild numbers from Novo Nordisk today. Now, the other interesting piece of information when it comes to, their market dominance, which, I think many of you are going, how do they dominate the market? Well, being first to the party is a real benefit for Novo Nordisk in this instance. So Novo Nordisk has actually tripled the number of patients on GLP-1s from 4 million to 12 million in just 3 years. So astounding number. 63% of the global GLP market is controlled by Novo Nordisk. The Catalent acquisition also playing into, we've covered this very closely, but Novo Nordisk acquired a company called Catalent at the end of 2024. We weren't sure at the beginning of 2024 whether US regulators or even European regulators would allow this merger sort of that happened, which ultimately netted Novo Nordisk 3 major fill and finish manufacturing sites, including one in Indiana. This expands their production capacity in a huge way, which will also play into the conversation that we'll get into a little bit later in regards to the supply and the availability of the compounded versions of semaglutide. So let's get into a little bit more about some of the newer obesity treatments that they're working on at Novo Nordisk. Obviously, one that we talk about a lot on this specific channel is Cagrisema. We got some Cagrisema data a couple of months ago. Maybe I'm very bad on timelines, but it's probably been at least 4 to 6 weeks. So close to 2 months. And this data really shocked the system when it comes to the Novo Nordisk stock. And really, so taking a look at Cagrisema, it showed 22.7% weight loss in this Redefine 1 trial. Now, the Redefine 1 trial had been billed by Novo Nordisk to most likely show a 25% weight loss across the board, and it ended up at 22.7. So back in mid-December, late December, when this information dropped, so did the stock for Novo Nordisk. But we'll get into a little bit of why some of the color around the information we learned from the Redefine trial today helps to sort of bring into perspective those numbers, because they're not exactly the greatest representation of total achievable weight loss on Cagrisema. There's some really fascinating information to dive into. But looking a little bit closer at Cagrisema and when we can expect this, because this is a big topic in the obesity world, because many people are looking forward to these new generation of treatments. It looks like they're planning further trials, which will start earlier this year. I think in that trial, they want to expand it, because essentially what happened in this trial is there was no forced dose escalation, meaning that patients were allowed to stay on the highest dose that they tolerated. Now, based upon that information, what's wild in this study, it's designed to really represent real life a little bit more, where previous trials for GLP-1s, they just wanted to slam people with as much medication as they could, get them to the highest doses, tolerated dose, get them to the highest dose that was proven to be safe in previous clinical trials. and get them there as fast as possible, and then, just ramp up that weight loss. That's what we saw in the clinical trials for tirzepatide with Eli Lilly for the Zepbound and the weight loss, the Surmount trials for tirzepatide, where people were forced to get to that 15 milligram. On the Cagrisema trial here and the Redefine trial, that wasn't the case. You jumped in, you basically went to the highest dose that you could tolerate. An interesting way to parse out this data is that it seems like what the data is showing is that patients that get to the highest tolerable dose, which may not necessarily be the highest dose, experience more side effects, but they also experience greater weight loss. So in other words, people on the lower doses of Cagrisema in this trial actually lost more statistically than the people who got to the highest dose. Why is that? Because this is what we see in the real world. With each one of these medications that come out, you have certain people that are super responders and people who are slower responders. So for the slower responders, they got up to the highest dose, experienced fewer side effects, but also experienced less weight loss. We've also seen this bear out in clinical trials for tirzepatide, where patients who experience greater amount of side effects with the medication are also more likely to experience greater weight loss. And so you're sort of seeing that bear out across the clinical trials for all these medications, including Cagrisema, which is maybe the most glaring data that we've gotten, because again, in this specific clinical trial, people were not forced to go to the highest dose. So the Cagrisema data continues to sort of come into focus, I think, a little bit, and giving investors and patients both sort of looking at this a little bit more context to digest, as it were, that information about that 22.7% weight loss, which was still higher than tirzepatide, right? But I think the big thing is you've introduced an amylin agonist. People are going to respond different to this hormone analog than they are to previous versions, right? And one of the things that these trials are trying to flush out with Novo Nordisk in not forcing the dose escalation is to treat obesity as the nuanced disease that it is, and individualize the treatment for each individual patient given their individual needs, right? So Novo Nordisk continued to sort of hammer home the idea that patients who can sort of not self-regulate, but sort of in collusion with their doctor, self sort of determine where their most tolerable dose is, are really driving the ultimate outcomes. And Novo Nordisk is definitely trying to shift away from this mentality. And I 100% agree with it, that we just want to slam people with the highest weight loss as possible. Wall Street tends to like that, but patients, not so much. And you see that in some of the adherence that rates that go on to these medications when it comes to the side effect angle. When doctors prescribe this, they tend to look at the clinical trials and follow that as the roadmap for treatment for their patients. Whereas these trials, like the Redefine 1 trials, tending to bear out that treating patients individually, allowing them to titrate up slowly and as they tolerate it. And more importantly, and we've heard this from Dr. Daniel Rosen specifically on the pen the couple times that he's been on, considering each dose of the weight loss medication or anti-obesity medication that you're on, viewing it as a rung of the ladder. And you want to climb those rungs slowly and get as much weight loss out of each dose as possible before you just go titrating up. Because eventually, if you just rush to the top, which was essentially my story with Mounjaro, you have no more ladders of the rung to climb. And so climbing them slowly is an important part of maximizing the effectiveness of these drugs. So I applaud Novo Nordisk for sort of changing course, even though it probably cost them a little bit in the meantime, as far as the way that Wall Street interpreted this data. But I think what you're seeing today is sort of a reversal, slowly, but a little bit of a reversal from that data as Wall Street continues to sort of interpret this new data. Now, we're going to continue to move on into the Step Up trial. Now, the STEP trials were specifically for semaglutide. So the Step Up trial was a high dose semaglutide trial where patients on the 7.2 milligram dose, the current highest dose available on the market of Wegovy is 2.4 milligrams, right? So this specific trial is showing that patients on 7.2 milligrams of semaglutide actually achieved a 20.7% weight loss, which is really amazing news. This one we are likely to see probably submitted sometime this year. And hopefully the approval comes along quickly thereafter. That tends to be a relatively quick process when there's a drug already approved on the market and a drug company is able to show that patients can safely tolerate higher doses. Tends to be a little bit quicker than a completely new drug with a completely new indication. Now, I'm not sure if I mentioned this earlier, but one of the big news out of this, and perhaps the biggest news for patients out of this whole earnings call, is that Cagrisema, which Novo Nordisk had been shooting for as a timeline, regulatory approval submission in 2025, sometime in late 2025. They did announce today that that regulatory submission won't happen until early 2026. So that pushes Cagrisema out to mid 2026 before it would potentially be available on the market, which is a huge kind of setback for patients who are waiting eagerly for the next generation of medication. It also puts into focus how interesting the battle between retatrutide from Eli Lilly and Cagrisema will be, because they'll roll out at similar times. And all the positive information about Cagrisema aside, it does seem that retatrutide will absolutely blow it out of the water in many different ways. But each patient is going to need something a little bit different, so there's room for all of these at the table. But Cagrisema getting pushed out, that's why it's important to put into perspective that semaglutide 7.2 milligrams achieved 20.7% weight loss, so 3 times the highest dose, will hopefully be available. My hope is sometime this year. And so that's not leaving us with absolutely nothing to look forward to in 2025. Now let's take a look at the next slide. We're going to talk a little bit about Amocretin. We've talked about this lately as some data just dropped about a week ago, I believe, on Amocretin. It completed a phase 1b/2a trial showing up to 22% weight loss. And this was an interesting one because Amocretin, which is being studied in both an oral and an injectable, but this Amocretin drug here showed some really promising results with 22% weight loss, and that was a shorter duration trial. So when you talk about the potential of Amocretin to be an effective therapy, especially with the idea of it coming out in an oral formulation, and what a game changer that could be. This is really exciting news for Novo Nordisk investors and patients living with obesity alone. So we did a big deep dive. We've done a deep dive on all of these topics that if you feel like we're blowing through this, you can go back and check out. We did an Amocretin video. We did a deep dive into this study. We did a deep dive into the 7.2 semaglutide trial. And we did a deep dive into the Cagrisema data too. We told you way back over a month ago when the Cagrisema news dropped, we kind of gave you all the color on that and why we thought the Wall Street reaction was likely a big overreaction, given that it was not a forced dose escalation trial. How's everybody hanging in with me today? I hope you're all hanging good in the chat. I'd like to just pause here and take a breath and welcome Natalie, DJ, Sue the Dude. Appreciate you being here with me today. Debbie, welcome, and thank you for being here. Helen, I want to thank you all for joining me on this not necessarily impromptu live, but sometimes we do a video rundown and upload it, and sometimes we do a rundown of these earnings call live. And so I thank you all for joining me. Let me know you're here in the comments, say hello, and we'll continue to move on here. So the pipeline of Novo Nordisk is also very exciting. I think one of the low key exciting things to consider is that Novo Nordisk has its own co-agonist, GLP-1 and GIP. It's only in phase 2, but they also have their own triple agonist in a clinical trial. So they are moving forward with a ferocious pace to keep up with Eli Lilly. I think one of the big stories is that it seems like while Novo Nordisk is the first to the party with the next best one, Eli Lilly is just always right on their heels with something better. And I think that was the case, obviously, with semaglutide and then tirzepatide. I think that'll be the same case with caglarinotide and then retatrutide. I think that's why Novo Nordisk and their investors were probably hoping for a little bit more of a gap between Cagrisema and retatrutide. But I think they do have some things to work out in their titration process with Cagrisema and managing side effects and things like that, because again, it is a completely new molecule. There are no long acting, I'm not sure there are any long acting amylin analogs on the market today. I think there are some shorter acting ones, maybe a daily, but obviously this is the next generation, so it'll be interesting to see how people respond to that. Moving on, let's talk about a little bit about Wegovy and the competitive landscape. We're kind of already getting into it. Of course, there are many, many, many drugs in the pipeline from many, many different companies at this point. We've been covering, I feel like lately there's just been news story after news story about the latest and greatest company that's kind of starting up and getting into the obesity space. We've talked a lot about Metsera. Yesterday we talked about another one. I can't even remember the name of it at this point. But yeah, there's just seems like every week there's somebody new jumping into the game. But Novo Nordisk is focusing on long duration obesity treatments. They're focusing on dose re-escalation strategies to enhance long-term weight loss. There's a lot of talk in this earnings call about quality of weight loss, not just worrying about getting to a certain percentage weight loss, but what is the quality of that weight loss? They have their own studies that are going on with preserving muscle mass. We covered one of them yesterday. They're working on oral GLP-1s. They're working on oral co-agonists and triple agonists. Really exciting. And then there are head-to-head trials planned with tirzepatide, which is going to be an interesting one. They, I believe, are running a trial that will explore Cagrisema head-to-head with tirzepatide. Now, it'll be interesting to see how that trial is designed, but we'll look forward to that. And I can't quite read when exactly that's starting, but I believe that is expected to start this year in 2025. So that might be a good one to, I'm not sure if it's enrolling currently, but if you are having a hard time accessing GLP-1s, clinical trials are always an interesting way to go. I know a friend of the show here, Jackson LeMay, sent a message about his father getting on a retatrutide trial that was retatrutide and maybe tirzepatide. And so it's a win-win trial, no matter which, there's no placebo arm. And so it's a great way to look at maintaining or gaining accessibility to these, is jumping into a clinical trial. And hey, you're doing your part to advance obesity medicine in the process. So definitely you can go to clinicaltrials.gov and just search these different medications: tirzepatide, retatrutide, Cagrisema, Amocretin. Just search these in the search bar at clinicaltrials.gov, and you'll be able to see all the trials that are currently enrolling for each one of these molecules that we talk about. Looking kind of forward here, we're getting a little investory here, but looking forward to 2025. And what Novo is seeing from a sales perspective, they're expecting a 16 to 24% sales growth in 2025. Obviously, that on the back of their semaglutide products. Of course, obesity medications are expected to really just continue to blow up in 2025. And they expect to return quite a bit of money to shareholders. I think they said they don't anticipate in 2025 doing any stock buybacks either. So really good shape overall for Novo Nordisk, a really good earnings call for them. I think that's played out in the way that Wall Street's responding. Now, there's a couple things that I want to get into more on the side of putting this in context of the news that we follow. And of course, one of the big things that we follow, there's always a question and answer session that goes on at the end of these earnings calls. One of the most interesting questions right now is about the fact that Novo Nordisk has removed semaglutide from the shortage list, but the FDA has yet to rule. Now, there's also a trial going on where the FDA is being sued by the Outsourcing Facilities Association over tirzepatide. So there could be like a little slow roll of how the FDA is choosing to act or not act on semaglutide. But one of the questions that continues to come up both in our community here at On the Pen, and now you hear in the investor community starting to ask about this. One of the interesting things that was baked into the report today from Novo Nordisk was this line here. Following higher than expected volume growth in recent years, including GLP-1 based products such as Ozempic and Wegovy, combined with the expectation of continued volume growth capacity, and their sales are booming, right? And limitations at some manufacturing site, the outlook also reflects expected continued periodic supply constraints and related drug shortage notifications across a number of products and geographies. Novo Nordisk is investing in internal and external capacity to increase supply, both short and long term. Some of what is in there is completely true. They purchased Catalent. That was not insignificant in their ability to manufacture supply. Now, one of the reasons they cited moving Cagrisema out to 2026 was their ability to make sure that they can ensure supply. So they definitely have increased their manufacturing capacity. But what did they say there? They just said that they continue to anticipate limited supply, interruptions in supply, yet we have semaglutide reported to the FDA as commercially available, and they're fighting, and they acknowledge this, they're fighting to get it removed from the shortage list. So one of the questions that came up was, how does that sit? Where's everything sitting with the removal of semaglutide from the shortage list? And basically the response is, we're in active dialogue and we're expanding manufacturing so that we can curtail future compounding. So there is a long-term play here going on, not just for some cagrilintide and for moreover Cagrisema. They're playing the long game here, and it is, make no mistake, it is their goal to eliminate compound versions of their product. Now, what is interesting is what you basically have, and you hear the same thing from Eli Lilly, is you have two pharmaceutical companies who are acknowledging that there are supply constraints, that they cannot always meet demand. Yet, what we have reported to the FDA is the complete opposite. It's commercially available. Take it off the shortage list. This is where I get really frustrated, right? Because I try to play everything as middle of the road as possible. I don't consider myself pro-pharma. I don't consider myself pro-compound. I don't consider myself anti-pharma or anti-compound. I just try to play the news down the middle, because what matters to me the most is patient accessibility, right? And patient accessibility is marred in this country by the system that leaves way too many people on the margins. However, when we do talk about the system, one of the interesting data points from today was that over 55 million people in the United States have access to Wegovy through their insurance, and 80% of them are paying $25 or less a month. That is a lot of people paying a very little amount of money for some absolutely life-changing medications. But that's not to say of the many millions of people who are left on the margins. Now, I feel like what continues to happen with these pharmaceutical companies is patients are being gaslit by the FDA shortage list that says that these drugs are commercially available, but the real world really slaps them in the face with a different reality. And I think this is eroding trust in pharmaceutical companies. I mean, many things have eroded people's trust in pharmaceutical companies, but when there's just an overt, what feels like non-truth coming from pharma, where they're telling the investors there's going to be supply interruptions, but they're telling the FDA there are no supply interruptions. In the middle, there's the patients who can't find their medicine. So that's why we continue to advocate here for expanded access to these medications vis-a-vis 503B responsible, safe compound pharmacies that offer a backstop to these pharmaceutical companies who simply cannot make enough of their drug. And you see that going on in the OFA versus FDA facility. That's why it has dominated so much of our content. A little piece of news from yesterday, actually, Iveem Health, which is a telehealth provider, filed an amicus brief in the OFA versus FDA trial. Now, you might be like, what even is that? So an amicus brief is like a friend of the court briefing, I think is what it ultimately means translated, where a interested party in a case can actually petition the court to submit basically a statement, more or less, about how what's going on or what's being discussed in a certain trial impacts them or impacts their interested parties. So you saw IVM Health kind of inserted themselves into this by filing an amicus brief, basically saying, hey, we have a bunch of patients who could potentially end up looking into really sketchy areas because they're going to lose access to not only their medicine, but their providers and everything like that. So people have asked me what my thoughts were on that. I don't think it shifts or changes anything. The judge in that case doesn't even have to consider the information. I think it's good that they're adding some color and information. Do I think it moves the needle? Probably not. But it'll be interesting to see how it goes. And I do think that it's a positive that they weighed in there. But I do think that it's important to know that filing an amicus brief doesn't have a huge amount of bearing on the outcome of this trial. But yes, so that's something that we continue to watch very closely here at On the Pen. We will continue to follow everything very closely through our website and our blog, which is onthepen.com. I get so many inbox messages. What do you think about this? What do you think about that? And my answer to many of the questions that I receive is, I think you should probably get email alerts because we've covered all of these things on the On the Pen blog. So if you wonder what I'm thinking about this topic or that topic, a very easy way to determine that is to just simply type in onthepen.com into your browser, and it'll take you to our website. Our website has been revamped, so it's very easy to navigate. It's got a ton of information there that I think would be super helpful for you to check out. Right at the top there, you can subscribe to the podcast, the email, and YouTube. But right here, GLP-1 News, if you click that, these are our top articles that pop up at the top. But if you click GLP-1 News, you're going to see all of these articles, and you can see thousands of people are reading these articles every week. You should be one of them. We send out email alerts on all of these, and that will keep you in the know. And so many people who come to my inbox and ask me what my thoughts are on A, B, C, or D, I've probably done an article. And if you don't know exactly where to find it, you can just come right up here into the search bar and type in something like Amocretin, and it's going to pull up any article that I have done that includes Amocretin. So the search bar is a very valuable tool at onthepen.com. If you're already subscribed to email alerts, put the word emails in the chat. If you enjoy them, let me know in the comments of this video. We put a ton of work into those this past year. And so I hope that you're enjoying those, finding value in those. If you're finding value in the work that we do, the best thing that you can do is just give us the thumbs up, give us the reviews, give the podcast a review, give the book a review. Anywhere where you're finding On the Pen content, just engage with it, interact with it. That's your part of this. Like I bring you the information. The part of it that makes us the OTP Army is the part where the Army gets mobilized and engages and interacts with the content and gets it out to the next person who can benefit from this information and have more competent and confident conversations with their doctor and just get better care for the disease that they're living with. Thank you for being here with me on this special edition of On the Pen Live, this Q4 earnings recap for Novo Nordisk. I hope that you enjoyed it today. I hope that y'all have a great rest of your day. Stay tuned tomorrow for On the Pen Live at 9 p.m. Central as we celebrate our 100th episode of On the Pen Live. It's our 100th episode tomorrow. We've got a special guest from way back when. Can't wait to chat and reminisce. Thank you for being here. Thank you for being the best part of what we do at On the Pen. Until next time, which is tomorrow at 9 p.m. Central, have a great and blessed day.